Uveitis, putting all the pieces together. Sometimes in uveitis cases, you're a detective. You're asking questions. You're trying to determine whether the patient has any systemic conditions that might be associated with uveitis. You want to know what their lifestyle's like, what risk factors they might have for infection, inflammatory diseases, or other causes. Now, let's make an example of looking at those lids and lashes. Actually, wait a second. Yeah, here we go. Let's look at those lids and lashes. At first glance, you might think, does this patient have blepharitis? But actually, think about it. You need to know what each of the drops you're giving to the patient is like. And that secretion and that white, discharge, like almost material, is pred forte emulsion. So we've got loads and loads and loads of flare here, lots of cells. The cells are reasonably immobile. They are moving, but they're reasonably immobile. We've got lots of decimase folds, so severe inflammation in the eye. Lots and lots of ciliary flush, lots and lots of conjunctival hyperemia. And here we can actually see we've got some intermediate uveitis as well. I don't think that's spillover. I think that is genuine intermediate uveitis. So we really need to treat this patient very aggressively, and we also need to think very carefully about a potential underlying cause for this patient's intermediate uveitis. We also need to make sure we check the fundus. We want to consider doing an OCT of the macula to check for any cystoid macular edema. We want to examine the patient carefully for any posterior involving uveitis, so any retinitis, any vasculitis. And this patient doesn't have that, although the view is hazy, and that could be for a few reasons. Number one, the vitritis, but number two, the cornea is also quite cloudy because of the decimase folds as well. So remember, there's lots and lots of clinical signs to see when patients have got uveitis. We need to not just treat them appropriately, but investigate them appropriately too, to investigate for a potential secondary cause.